Good afternoon, I'm Charles, a physical therapy assistant student at Miami-Dade College. Today we're going to demonstrate passive range of motion for abduction of the hip. The AMA lists the full range of motion as 40 degrees on that. My student patient today is Ms. Fernandez. Good afternoon, how are you doing?
Good.
Right. I'm Charles, physical therapy assistant student. Today we'll be measuring hip abduction. This is this motion here. Purpose of this measurement is to make comparison to your previous and future measurements to see how you're progressing through your treatment. Okay?
Okay.
Great. If I can have you lay down here on the bed, face up with your legs straight, please.
Okay.
The patient is in the testing position. She's supine. Her hips or her pelvis are in neutral. Her knee is extended, and her hip is at 0 degrees flexion, extension, and no rotation on that. First thing we're going to do is move the patient through available range of motion. I'm going to extend her out here. I'm going to apply a little additional pressure to feel the infill, and it's firm, which is a normal indication on that. I'm going to make a visual estimate of the range of motion, and it looks to be 40 degrees. We're going to turn the patient back to the starting position. We're going to have to palpate some anatomical landmarks for the position of the gomiometer. The first one is the ASIS. Going to do both sides of that. Right there. And we're going to, the knee as a reference for the midline of the knee for the distal arm. Going to align the gomiometer, the focal point over the measurement, ASIS. And we're going to use an imaginary line between the two for the proximal arm. And the knee, midline of the knee for the distal arm. Going to read and record the starting position as 0. Going to remove the gomiometer. And we're going to perform passive range of motion. I'm going to bring it back out this direction. Going to realign the gomiometer. Across there. I'm going to read and record the final position as 40 degrees. This is how you measure range of motion for abduction of the hip.